10 signs and symptoms of fatty liver and how to prevent it. Fatty liver disease is a frequent illness in which the liver stores excess fat. The majority of people have no symptoms and experience no negative consequences. However, in some situations, it can cause liver damage. The good news is that lifestyle adjustments can typically prevent or even correct fatty liver disease. Hey everybody, welcome to Boost Healthy, the video channel to live healthier and better. So before we get to the prevention, let's discuss the most common signs and symptoms of fatty liver that can appear if you have one. Number 10, abdominal pain. Even though your liver is the largest organ in your body, it might be difficult to determine the source of your pain. It's easy to confuse it with stomachache to its left. A hurting liver might induce discomfort in the front center of your belly, your back, or even your shoulders, depending on the cause. You don't have any pain receptors in your liver. An illness or injury usually causes pain to the membrane that surrounds it to inflate. Too much fat can build up in your liver due to obesity, diabetes, or a high cholesterol diet. This can damage your liver and prevent it from doing its job over time. Fatty liver is frequently asymptomatic. However, it can make you fatigued or cause dull pain in the right upper area of your stomach or all over it. Too much fat can also produce cysts around the liver. Cysts are fluid-filled pockets that aren't generally infectious. They may cause discomfort if they are huge, primarily because you feel stuffed in your abdomen. Cysts might bleed, causing significant pain in your upper right abdomen and shoulder. Number 9, steatohepatitis. The inflammation and damage produced by an accumulation of fat in the liver are known as non-alcoholic steatohepatitis, NASH. It's one of several disorders known as non-alcoholic fatty liver disease. You may be diagnosed with a fatty liver. A fat deposit in the liver affects many people, yet it usually causes no symptoms or issues. NASH can worsen and lead to liver scarring, leading to cirrhosis. However, the condition does not always worsen. NASH is similar to the type of liver disease induced by heavy drinking over time. However, NASH can develop in persons who do not drink. Experts are baffled as to why some patients with a buildup of fat in the liver develop NASH while others do not. Something in the environment may cause inflammation in some individuals, or it could run in their family. The majority of persons with NASH are between the ages of 40 and 50 and have one or more of the symptoms described above. However, NASH can develop in people who do not have these risk factors. Number 8, fibrosis. The growth of fibrosous connective tissue as a reparative reaction to injury or damage is referred to as fibrosis. Fibrosis can refer to either normal connective tissue deposition or excess tissue deposition that happens due to a pathological event. The term scarring is used to describe fibrosis that occurs due to an accident. Pulmonary fibrosis is a term used to describe a group of disorders that induce interstitial lung damage, fibrosis, and finally, lung elasticity loss. Symptoms of these illnesses include a chronic cough, chest pain, difficulty breathing, and weariness. Pulmonary fibrosis can develop as a side effect of various other illnesses, but in many cases, the origin is unknown, leading to the phrase idiopathic pulmonary fibrosis. Because the underlying problem that causes pulmonary fibrosis frequently takes years to develop, people with the disease often develop it later in life, with their frequency increasing between the ages of 50 and 70. Number 7, cirrhosis. Cirrhosis is a disorder in which your liver becomes scarred and damaged permanently. Scar tissue replaces good liver tissue, making it impossible for your liver to function correctly. Cirrhosis causes your liver to fail as it progresses. Cirrhosis manifests itself in a variety of ways, including weariness and itchy skin. They may not show up until the liver has been severely damaged. Alcoholic liver disease, non-alcoholic fatty liver disease, chronic hepatitis C, and chronic hepatitis B are all possible causes. Cirrhosis is diagnosed based on your medical history, physical exam, and test results. Blood tests, such as liver function testing and viral infection tests, imaging tests, and liver biopsy are among the tests available. Cirrhosis has no specific treatment available to doctors. They can, however, address many of the disorders that lead to cirrhosis. Treating the underlying causes of cirrhosis can help prevent liver failure and keep your cirrhosis from worsening. Number 6, loss of appetite. If your liver is affected by something, The first thing is that the person loses his appetite. The loss is very sudden and general. You will feel your stomach being full even if you haven't eaten in days. The appetite loss is so severe sometimes that after starving for days, still no hunger. If you eat something forcefully, it will vomit itself out then and there. You'll go to the bathroom and excrete the waste out, but if the feces is almost white in color, it means that there is something wrong with your liver, and you have to go to the doctor immediately. The liver damage can sometimes be stopped or even reversed. However, the disease continues to advance in others. Controlling any diseases that may contribute to fatty liver disease is critical if you have NASH. You don't require any particular therapy if you have NAFLD and no other medical issues. However, implementing simple lifestyle adjustments can help you manage or reverse liver fat accumulation. Number 5, yellow skin and eyes. When your body produces too much bilirubin, a yellow pigment that occurs when red blood cells break down, the whites of your eyes may turn yellow. Usually this isn't an issue. Bilirubin is removed from your blood by your liver, which then turns it into bile. Bile travels through your digestive tract through narrow tubes called bile ducts before being expelled as trash. Hepatitis is an inflammation of the liver. A virus that affects liver cells, such as hepatitis A, B, or C, is frequently the cause. The infection can be acute, short-term, or chronic, long-term, meaning it lasts at least 6 months. Hepatitis causes the liver to become ineffective in filtering bilirubin. This may cause jaundice. Hepatitis can be caused by medications or autoimmune illnesses in which your immune system assaults your body. Learn about hepatitis C's early warning signals. Number 4, edema. Fatty liver disease is often overlooked since it shows no signs or symptoms. Most of the time, it is discovered during sonography that was initially performed for another purpose. However, it is critical to pay attention to the warning sign and adopt dietary lifestyle modifications. Because these are severe symptoms, you should visit a liver expert as soon as possible. These symptoms could point to cirrhosis or liver failure in the liver. Only a tiny percentage of people with fatty liver, cirrhosis, or liver failure may require a liver transplant. People with fatty liver might develop symptoms such as enlargement in both feet, swelling in the body with water, called ascites, excessive tiredness or irrelevant talking, called encephalopathy, jaundice, yellow eyes or urine, and even blood vomiting if the condition is ignored for an extended period. Number 3, pale stools. Stool color can be affected by various factors, including vitamins, illnesses, and particular diets. Stool color can also be affected by underlying medical issues such as gallbladder and liver illness. Pale stool, mainly white or clay-colored feces, can signal a significant health concern. The brown color of a healthy bowel movement is caused by bile from the liver. When the stool is pale, it usually indicates that not enough bile is reaching the stool. Problems with the gallbladder, pancreas, or liver can cause bile deficiency in the feces. People who have pale stools regularly should consult a doctor about disorders that impact these organs. Number 2, itchy skin. An itch, also known as pruritus, is an uncomfortable skin sensation that prompts the desire to scratch. It is a symptom of many skin illnesses, but it can also be caused by an acute or chronic condition, such as certain types of liver disease. Itching is uncommon in alcohol-related and non-alcoholic fatty liver disorders. Still, it is common in other forms of liver illnesses, such as primary biliary cirrhosis, PBC, primary sclerosing cholangitis, PSC, and pregnancy-related intrahepatic cholestasis. Number 1, dark-colored urine. Dark orange, amber, cola-colored, or brown urine can indicate liver illness. The color is caused by a buildup of bilirubin in the liver, which isn't being broken down properly. These signs and symptoms suggest that your non-alcoholic liver disease has advanced to the late stages and that your liver is no longer functioning normally. Seek medical help right once if you experience such persistent signs and symptoms. How to reverse. There are currently no approved drugs to treat fatty liver disease. More research is required to develop and evaluate medicines to treat this illness. Most stages of fatty liver disease can be reversed with lifestyle adjustments in many situations. Your doctor may, for example, encourage you to limit or avoid alcohol consumption, take weight loss steps, make dietary modifications, avoid liver-damaging drugs and supplements. If you have AFLD, your doctor will tell you to stop drinking totally. If you have an alcohol use disorder, they may also recommend a detoxification program and therapy, AUD. Several viral infections can cause liver damage. Your doctor may recommend getting hepatitis A and B immunizations to preserve your liver health. They may also suggest regular hepatitis C screenings depending on your situation. That's all from today's video. Hope you enjoyed it. Let us know in the comments section if these 10 signs and symptoms of fatty liver were helpful. Subscribe and turn on notifications so you don't miss more interesting health videos and much more. Check out this playlist of latest uploads, and I'll see you in the next video. Take care.